When it comes to our pets, those bundles of joy that fill our homes with laughter, loyalty, and love, we never want to imagine them in danger. Yet emergencies can happen in the blink of an eye. A playful leap turns into a painful injury, a curious sniff leads to a toxic nibble, or a routine meal suddenly results in choking. In these critical moments, your ability to act swiftly and wisely could mean the difference between life and tragedy. Today, we're exploring the essential first aid steps for pets, empowering you to be the hero your furry friend might one day need. Let's begin with the basics. Preparation. Just as you wouldn't want to be caught off guard when a human family member gets hurt, the same goes for our pets. Many people assume their home first aid kit will suffice, but pets have unique needs and risks. So what belongs in a well-stocked pet first aid kit? First, gauze and bandages are vital for stemming bleeding and protecting wounds. Choose non-stick pads and flexible bandages that won't constrict movement or circulation. Scissors are essential for cutting bandages to size or trimming fur around injuries, while a thermometer, preferably digital and designed for pets, helps you quickly detect fever or hypothermia. Disposable gloves are a must, protecting you and your pet from cross-contamination, and a pet-safe antiseptic solution is crucial for cleaning wounds. Remember, never use alcohol or hydrogen peroxide, as these can damage delicate tissues. I learned the importance of preparation the hard way. One summer afternoon, my cat darted across the yard, only to yowl in pain. A jagged piece of broken glass had sliced her paw. In that moment, panic threatened to take over, but having sterile gauze and bandages at hand allowed me to clean and dress the wound before rushing her to the vet. That simple act of readiness made all the difference, and it's why I urge every pet owner to assemble their own pet-specific kit today. But having supplies is just the first step. Emergencies don't wait for us to feel ready. So, let's walk through what to do when the unexpected strikes. Imagine your dog is playing fetch, bounding after a favorite ball, when suddenly he starts coughing and pawing at his mouth. Choking is one of the most urgent and frightening emergencies pet owners face. The key in moments like this is to stay calm. Panicking will only distress your pet further and cloud your judgment. First, quickly but gently examine your pet's mouth. If you can see the object causing the blockage, use your fingers to carefully remove it, but be cautious not to push it further down or get bitten. If you cannot see or safely remove the object, the Heimlich maneuver for pets may be necessary. For small breeds, hold your pet firmly and apply gentle, upward pressure just below the rib cage. For larger dogs, you may need to lift the back leg slightly and press firmly on the abdomen behind the rib cage. This action can help dislodge the object. Once the airway is clear, monitor your pet closely for signs of distress or injury, and consult your veterinarian immediately. Breathing difficulties aren't always caused by choking, though. Sometimes, the culprit is poisoning, a silent, invisible threat lurking in everyday items. Household cleaners, foods like chocolate or grapes, or even decorative plants can be toxic to pets. Poisoning can manifest as vomiting, excessive drooling, weakness, or seizures. If you suspect your pet has swallowed something harmful, resist the urge to induce vomiting unless specifically instructed by your veterinarian. Some substances can cause more damage coming back up. Instead, immediately call your vet or an animal poison control center. Provide as much information as possible: what your pet ate, how much, and when. If possible, bring the packaging or a sample of the substance to the vet's office. This can be vital in determining the best course of action. I'll never forget the time a friend's dog got into a bowl of grapes left on the table. Within minutes, the dog became lethargic and started vomiting. Because my friend acted quickly, calling the vet and following instructions, they were able to prevent serious harm. Time is of the essence in poisoning cases, so always err on the side of caution. Now, let's talk about another common emergency: bleeding and wounds. Animals are naturally curious and energetic, making them prone to minor scrapes and cuts. If your pet sustains a wound, start by calming them and restraining them gently, if needed. Clean the area with pet-safe antiseptic solution, removing dirt and debris. Apply gentle pressure with sterile gauze to stop the bleeding, and once it slows, you can wrap the wound loosely with bandages. Be careful not to wrap too tightly. Restricted circulation can worsen the injury. However, not all bleeding is minor. If blood is spurting or soaking through bandages rapidly, it could indicate a serious arterial wound. In these cases, apply firm pressure and get to a veterinary clinic immediately. Even a small cut can be more serious than it appears, depending on the location and depth. Always monitor your pet for signs of shock, such as pale gums, rapid breathing, or weakness. For more severe injuries, such as those involving broken bones or deep wounds, minimize movement and keep your pet as calm and comfortable as possible while you seek professional help. Don't try to set bones or close large wounds yourself. These require expert care. Perhaps the most frightening emergency is sudden collapse. You find your pet unresponsive and every second counts. First, check for breathing by watching the chest for movement or feeling for breath near the nose. If your pet isn't breathing, gently close their mouth and blow into their nose, watching for the chest to rise. This is the pet equivalent of rescue breathing. If there is no heartbeat, you may need to perform chest compressions. For most dogs and cats, press firmly on the widest part of the chest, just behind the front legs. Use both hands for larger animals and one hand for smaller pets. Compress at a regular rhythm, allowing the chest to fully recoil between presses. Continue until your pet revives or until you reach the vet. These emergency measures are only meant to buy time until professional help is available. Never delay seeking veterinary care. Animals can deteriorate rapidly, and even successful first aid needs expert follow-up. With all these steps to remember, you might wonder how you'll recall them in a crisis. The answer lies in preparation. Save your veterinarian's phone number in your phone and post it in a visible location, such as on the fridge or near the front door. Consider taking a pet first aid course. A hands-on class will teach you techniques and build your confidence. Most importantly, practice staying calm. Run through emergency scenarios in your mind so you're ready to act rather than freeze when the moment comes. Preparedness is not just about supplies and skills, it's also about mindset. Our pets are intuitive, picking up on our emotions and energy. If you remain calm, you'll help them feel safer and less stressed, which can improve the outcome of any emergency. Beyond these immediate responses, there are preventative steps to help keep your pet safe. Regularly inspect your home and yard for hazards, sharp objects, toxic foods, accessible cleaning supplies, or open windows and doors. Train your pet to avoid dangerous behaviors, like chewing on electrical cords or eating from the trash. Keep up with regular veterinary checkups, vaccinations, and parasite prevention, all of which reduce the risk of emergencies. During travel, be extra cautious. Bring your pet's first aid kit, keep them secured in a carrier or seatbelt harness, and research emergency vet clinics along your route. If your pet has known medical conditions, carry a summary of their history and medications, and never leave pets unattended in vehicles. Temperatures can rise or fall quickly, putting them at risk of heat stroke or hypothermia. It's also wise to know the signs of distress in your pet. Dogs and cats express pain and illness differently than humans. Look for subtle cues. Changes in appetite, hiding or clinginess, restlessness, excessive licking or scratching, or vocalizations. Early detection of problems leads to better outcomes. Let's talk briefly about some common conditions and how to respond. Heat stroke can occur quickly, especially in hot weather or poorly ventilated spaces. Signs include heavy panting, drooling, lethargy, vomiting, and collapse. Move your pet to a cool area, offer small amounts of water, and use cool, not cold, damp towels on their body. Seek veterinary care immediately, as heat stroke can cause organ failure or death. Seizures may be caused by epilepsy, toxins, or other medical issues. If your pet has a seizure, keep them away from sharp objects and avoid restraining them. Time the seizure, and once it ends, comfort your pet and call your vet. Never place your hands near their mouth. They won't swallow their tongue, but they could bite unintentionally. Allergic reactions, such as those from insect stings or medications, may cause swelling, hives, vomiting, or difficulty breathing. If you notice these symptoms, call your vet right away. In severe cases, where breathing is compromised, administer CPR and get to emergency care. Fractures and sprains can happen during rough play or accidents. If you suspect a broken bone, immobilize the limb with a towel or makeshift splint, but don't attempt to realign it. Transport your pet carefully to the vet, minimizing movement. Eye injuries, such as scratches or foreign objects, should never be treated with human eye drops. Gently flush the eye with sterile saline if possible, and keep your pet from rubbing their face. Seek veterinary attention promptly. In all emergencies, your role is to stabilize your pet, prevent further harm, and get professional help. The more you prepare today, the more effective you'll be when every second counts. Being a responsible pet owner means more than providing food, water, and shelter. It means learning the skills that can save a life, whether that's knowing when to rush to the vet or having the confidence to perform CPR. It means cultivating a home environment free of hazards, and staying informed about new risks and treatments. Our pets trust us implicitly, looking to us for comfort and protection in every moment. They don't understand the dangers that lurk in the world, nor can they ask for help in words. It's up to us to be vigilant, compassionate, and ready to act when they need us most. Think of this knowledge as a gift, not just to your own pet, but to every animal you may encounter. Share tips with fellow pet owners, encourage friends and neighbors to prepare, and advocate for pet safety in your community. Together, we can create a world where fewer emergencies become tragedies, and more pets live long, healthy, happy lives. If you found these tips helpful, consider deepening your understanding through pet first aid courses and ongoing education. Each week brings new insights and advances in veterinary care, and staying up to date keeps your skills sharp. Remember, being prepared is an act of love. You may never need to use these emergency steps, but if the day comes, your quick thinking and calm response can be the reason your pet comes home safe. Your furry friend deserves nothing less. Thank you for joining me on this journey to protect and care for the animals who enrich our lives so deeply. Together, let's continue learning, sharing, and growing as a community of pet lovers and guardians. Your pet's health and happiness are in your hands. Make every moment count, and always be ready to step into the role of hero when it matters most.